Hello friends, I am Dr. Prathama Chaudhary, Professor of Psychiatry practicing in Kolkata. Today, let's have a look at a rather longish term, postpartum mental health. Postpartum refers to the period after childbirth. And, believe it or not, this is the time when a lot of psychological problems come to the surface in a large number of people. This may come as a surprise to many because we usually associate motherhood with fulfillment and joy. But this is also the time when a woman's body goes through dramatic changes. Within 48 hours of childbirth, estrogen and progesterone, the two female hormones, fall precipitously, and often our body is overwhelmed by this. These hormones modulate brain function and therefore affect our behavior. In addition, a newborn baby does not have a regular sleep-wake cycle. So, in order to breastfeed her, the mother often has to get up several times at night. This disruption of sleep takes a heavy toll on her psychological well-being. Also, a mother often does not have the necessary support and comfort she deserves soon after childbirth. In today's nuclear families, this is a matter of genuine concern. Sometimes, giving birth to a child who is ill or has some inborn abnormality adds to the mother's worries. And unfortunately, even today, giving birth to a girl child can be a cause of stress to the mother in many parts of the world. What are the common mental health problems that a new mother can experience? First of all, the commonest constellation of symptoms like tearfulness, irritability, anxiety and mood swings, insomnia and fatigue is known as postpartum blues. It can occur in 50 to 80% of all mothers. It usually starts within the first 3 days after childbirth. A large majority of mothers get over these symptoms within a few days, at the most a fortnight. During this period, we should be supportive, tell her that such symptoms are quite common and that she shouldn't feel guilty that she is not being able to, quote unquote, love her baby. Though unsettling, the symptoms do not interfere with the mother's ability to function. That is, she can go about doing her household chores, looking after the baby, and so on, though she is not very comfortable doing them. We just have to be by her side and keep a close watch over how her symptoms are progressing. Because around 25% of women with postpartum blues may progress to postpartum depression. Now, this is a serious illness. It may occur at any point of time within the first few months of delivery. The symptoms of postpartum depression are a persistent, unremitting, sad mood, loss of interest and pleasure. You tend to lose out interest in all things around you, and the things that were so pleasurable to you, like let's say listening to music or watching a movie, are no longer pleasurable. There is also feeling of a guilt, feelings of worthlessness, hopelessness, and helplessness. Disturbed sleep or appetite can also mark some of the symptoms of postpartum depression. It is very important to recognize all these because early intervention is required. We must see the psychiatrist without delay. Many mothers may otherwise develop alarming symptoms like suicidal ideas and repetitive, intrusive, violent thoughts, even thoughts about harming the baby. If we do not seek help in time, we may even lose the mother and her baby. The psychiatrist may prescribe medicines or psychotherapy. The child's safety will also be considered. If medicines are given, the doctor will guide you about whether the child can be breastfed or not. Most of the times, breastfeeding is possible provided some precautions are in place. A much rarer form of postpartum mental illness is called postpartum psychosis, which occurs in 1 or 2 of every 1,000 mothers. This is often characterized by hearing unseen people's voices, feeling extremely scared, and behaving very abnormally in general. This is a medical emergency. We must immediately seek help. Remember, chances of suicide or even hurting the baby is very high in postpartum psychosis. Can we intervene a little early when postpartum psychosis is not fully developed? Yes, we can, if we keep a close watch. If the mother appears perplexed, irritable, and sleeps very little, it is important to understand she is behaving differently, be supportive without panicking ourselves, and seek a psychiatrist's help urgently. Other than these illnesses, the period following childbirth is also a vulnerable window for developing anxiety disorder and sleep disorders, and also obsessive compulsive disorder or OCD. OCD is an illness associated with repetitive, meaningless thoughts crossing our minds. These thoughts often center around the baby. We know they are absurd but cannot get rid of them. Nonetheless, all of these symptoms, be it OCD, anxiety, depression, or even psychosis, respond to treatment. The key is early detection and immediate referral to the psychiatrists. Treatment results are good. Can we prevent postpartum psychiatric complications? Well, sometimes. If we are supportive of the mother from day one, ensure she sleeps well, which may mean going to sleep every time her baby sleeps, and make sure she gets good nutritious food and her anxieties are sympathetically addressed, we may be able to some extent, prevent these symptoms. If we cannot, the best we can do is be alert, recognize early signs and symptoms that we have discussed so far, and seek help without delay. Postpartum mental health is a very important issue and we must take note. Thank you for listening. This is from Dr. Prathama Chaudhary, consultant psychiatrist,